And I want to talk about the hair loss piece for a bit because that was something that I struggled with for a long time. And not once did anybody say, oh, well, maybe it's because of your hormones. And I'd be curious to know more about that. But also, do you see women who went into perimenopause, didn't do anything about it for a long time, and then started on hormone replacement therapy? Do you see a change in their hair? I'm asking for a friend.
Oh, totally. I love this. Well, I think there's a couple of things that we want to look at when it comes to hair loss. And there's sort of two nutrients that are really important for supporting hair growth. And one of them is vitamin D. And so we would want to test vitamin D to make sure we're not deficient. And if we are, we would want to supplement appropriately. And the second one, which is very relevant for perimenopause, is low iron. And so it's very common in perimenopause that women have heavy cycles. I'm assuming that may have been part of the picture with the ablation to stop the bleeding, is we have really heavy periods. And that will often lead to low iron, which does not favorably support hair growth.
Welcome to this week's episode of Her Unshakeable Confidence. I'm Simone Knego.
And I'm Olivia Knego.
And today is a conversation I've been wanting to have for a really long time. So I'm really excited to have doctors Nic and Nat with us today because we're going to talk about all things hormones, menopause, because right now I am postmenopausal and I didn't even know it. I know it now. So thank you so much for joining us today.
Thanks for having us. We're excited for this conversation.
Yeah, super excited. I'm sure Liv's like, wait, we're talking about menopause. But you know what? You should know it before you need to know it.
You're putting words in my mouth. I'm actually really interested. You guys are naturopathic doctors.
Correct, yes.
See, that's really interesting to me, Mom, because I'm in my ongoing insurance battle right now and I need alternative remedies.
Yeah, true point. Okay, I want to start with our normal start, which what does confidence mean to you? And both of you can answer. One of you can answer. You guys choose.
We'll do our twin thing. We'll tag team. Confidence for me means showing up even when you don't want to. Showing up when you still have the discomfort, the uncertainty, and doing it anyways. Showing up for yourself, putting yourself in situations where you normally may not. I think I used to always think that courage came first and then confidence. Confidence came first and then courage. And then I, have realized that it's actually the opposite. Is that we need to take the courage, we need to show up, and then that is where the confidence grows. Yeah, and I think it's being authentically you in every moment, and really sort of being that fully expressed version of yourself and stepping boldly into situations and being okay with just being truly vulnerable and just authentically you, I think is sort of my version of confidence.
Yeah, I love that. And I think that it's always interesting when we ask this question because we get a different answer from every single guest. And I think that's a really important part because confidence means something different to everyone. And I think it's important that we step into confidence the way we feel comfortable stepping into confidence. And the point you made about starting with courage, I mean, I agree 100% because I feel like it's that idea of you take the next step, right? It's that just one more step. And that's what brings you to the confidence. You don't have confidence, say, okay, now I'm going to try things. It's like you got to try things and put yourself outside of your comfort zone. So let's talk about hormones because I just turned 53. I am someone who has struggled with sleep and hair loss and different weight issues here and there and just kind of ignored everything because it wasn't something that we really talked about, right? It wasn't something that my mom ever said, oh, when you get to this age, this is what you should be doing. I don't think she even really knew when she went into menopause and what that really meant. So I would kind of love to just start there and really talk about perimenopause, even though I'm postmenopausal, but let's talk about perimenopause and kind of define it for
Wait,
the
can we
women
start
who
from
have...
the beginning?
Oh, okay, sorry.
What is menopause?
Okay.
Yeah. Okay. Well, let's start there because that's a really beautiful place to start. So most people don't appreciate that menopause is actually a day. It's your 1 year anniversary of no period. So once we've gone 12 months without a period and we've crossed that, that's your day of menopause. Every day thereafter, you're considered postmenopause. The years
That seems like a celebration thing, honestly.
right? It's a birthday.
Yeah.
It's a celebration. It's a thing. Absolutely. The years before that are perimenopause. So perimenopause can happen years before you actually have that menopause birthday. So that can happen 7 to 10 years before. It's when our hormones are fluctuating. It's when things are ebbing and flowing. It's when we start to get symptoms. So it's those years before, kind of those really turbulent years where estrogen and progesterone are just doing their wild dance, and we can get some symptoms from that.
Yeah, I would tell you that part of the reason I didn't really understand what was happening to me is that I had an ablation. So I kind of didn't have periods, and then sometimes I did. And I was like, what is wrong with me? Then I found out I had a weird bleeding
What did the
disorder.
words you just said mean?
Oh.
I'm in law school. I am not in med school.
So I had this like laser treatment to the lining of my uterus to kind of, because I had such weird bleeding and stuff, to kind of like stop the bleeding. Now it didn't really stop it. It kind of, so then I never really knew, okay, am I in menopause? And now it's confirmed. I'm like postmenopausal. I didn't even, but what's interesting is when I was perimenopausal, I actually didn't have hot flashes and stuff then. Like I guess I've had hair loss for a really long time, but I didn't have really anything else that led me to believe, oh yeah, this is like, I'm done. Until I got blood work. I'm like, oh yeah, I'm really done. Like it's not even, estrogen's not even detectable. Okay, that's interesting.
Yeah, and I think the hot flashes and night sweats are like the star of the show, and it's the ones that we talk about, but typically they happen later in the transition. And, there's not a textbook experience of perimenopause. Like every woman's experience through this transition is different. But typically, what we will see clinically is like the hot flashes and night sweats start later. It's the mood changes, it's the sleep issues, it's the fatigue, it's the I don't feel like myself. The heavy periods, the period cycle lengths are changing. We're starting to get periods closer together or further apart. We're starting to see some of those changes.
When's the earliest you've seen someone go into perimenopause and then menopause? Because it's interesting. I have a friend of mine that we were at a conference together a few weeks ago, and she was telling me that she actually went through menopause when she was in her early 30s, like completely. Yeah, like so but yeah.
Yeah, like normal menopause happens between 45 and 55. The average age is around 51. It's considered early menopause if it's between 40 and 45. Um, and then someone will even go through that earlier, which is premature ovarian insufficiency is usually what happens before 40. But if normal is 45 to 55 and perimenopause is 7 to 10 years before that, we can usually start to see symptoms in some women as early as their mid to late 30s. Yeah.
So when you're looking at, I mean, we talked about some of the symptoms, but what are some of the early indicators? Because again, sometimes we're just like, I'm in a crappy mood. Am I going to get my period? Right. I mean, but I think it's obviously more than that.
Totally. And I think that this is where a lot of times women get dismissed. Oh, you have children. Oh, you're working. Oh, you're not sleeping. And it can get dismissed and or maybe given a different reason, or you need to sleep more, or you need to manage your stress, and we give it other context. So I think it's really important that we listen to women and we listen to their stories and we have these conversations so that women can feel really supported through their journey. And I think it's important to know that to diagnose perimenopause is actually a clinical diagnosis. It's a conversation between a patient and a clinician in an office. There is not a test that needs to be done to confirm it. And so what sometimes happens is that women will get their hormone levels tested. And in perimenopause, your hormone levels are they're so erratic. And so what you're testing today may look very normal. And then yet next month tomorrow is very different. And so we get this, 1 day snapshot of your hormones and we're told everything's normal. And yet they know that there's a shift or a change happening and they get dismissed.
Yeah, which makes a lot of sense. Again, when I was saying about getting my levels checked, that was because I was like, I'm sure I've been through menopause because I don't know what's happening. And yeah, sure enough, like but that makes sense that for perimenopause, it's really a conversation. And I'm curious if that's something that gynecologists, a conversation they actually have with their patients, or because what I found really difficult in my area is to find someone to be able to really specialized in this, right? That to be able to ask all the questions to, because it's like, oh no, I remember years ago, this was ridiculous, but I was struggling with something, and I want to say this was 20 years ago, and my gynecologist at the time was like, here, you start using this estrogen cream. And I was like, but why? Like, I couldn't even get an answer. And I was like, I don't think I'm going to do that. Like, this doesn't sound like because I wasn't getting answers to what I really needed. And I love that the fact that that's your focus. But do you feel like most gynecologists like focus they don't really focus on this, right? I mean,
There's a huge gap in education and through the medical system in terms of educating physicians about perimenopause and menopause. There's additional training, like we went on to do additional training with the Menopause Society to inform ourselves. I would even say, I don't think the naturopathic education is that dissimilar from the medical education, that I don't think I learned a lot about perimenopause and menopause in our actual school curriculum. It was through the additional training and learning that I got informed about this. The Menopause Society is a society in North America that allows certification for you to find a provider who is certified in additional menopause training. And they have a wonderful resource of practitioners, a list on their website of practitioners who are well versed in this. So I usually tell patients or people who are in different areas, if they're looking for someone, that's a really great resource or place to start.
yeah, that's amazing because I had never heard of that. Now, what's interesting is that recently there's been more and more celebrities talking about menopause. And I think there's going to be probably more and more people like really having open conversations because, again, it wasn't something that we talked about before. I want to kind of get your thoughts on. So, like, I believe Halle Berry is openly talking about it. Oprah doing, whether she did it already or not, some big kind of meeting about talking about menopause. What are your thoughts on that? And what, I mean, obviously, I think it's great that we're talking about it, but why now? Like, why do you think it's, finally happening?
Yeah, I think it's about time. I think it's great that we're having this conversation. I love that it's getting attention and we're putting women's health on the forefront. I think, I always kind of equate it to like, what if we didn't teach young girls about puberty and their bodies were going to change? And this is sort of like the equivalent in midlife. So I think it's amazing that people are using their platforms to discuss what's going on. There's a stat that came out that said like 46% of women feel unprepared for this phase of life, and 4 in 10 feel alone in their menopause journey. So I hope that these conversations are going to change those statistics. I hope that this is going to be when my daughters move through this and the next generation moves through this, they feel really supported and empowered. The number one thing that we'll hear in our office and the number one thing that I'll hear is women say to me, I don't feel like myself. Talk about like stripping confidence away from a woman when they're like, I don't recognize this body. My moods are all over the place. I'm irritable. I don't know why I'm doing this. When really, if we can just support your hormones, like what a different experience that will be for women today and then women coming through this. Like, this isn't niche. Like, this isn't like a niche problem. This is going to happen to everyone who is born with ovaries. Like, so I think it's amazing that these conversations are happening.
Liv, you look like you were going to ask something.
I just don't even know why I have to prepare for this. Okay, I have no knowledge of women's health, and the more and more I talk to my friends about this, neither do any of us. And like, it's a range of, I went to private school and public school. I have friends that went just public, just private, and none of us have like any understanding about women's health. I mean, it took me until college to realize like the reason my jeans don't fit every day is because I have a cycle and you go through changes in your body on a daily basis. And I thought I was just like alone in that. So I feel like I have no women's health knowledge.
I mean, I think we can like back this conversation up and talk about even just supporting women through their fertile years in terms of appreciating their estrogen and progesterone fluctuations and when they're actually fertile and what that looks like and what ovulation is all about. And there's changes in cervical mucus and like just educating women about that. I remember early in practice having a patient come in and she's like, I'm having lots of like vaginal discharge and I don't know what's going on. And, we did a swab into the history and it turned out it was just ovulation. I'm like, that's just your ovulation discharge. That's just cervical discharge. Like, but we somehow have kind of like dropped the ball on educating women about these cycles and these rhythms.
Speaking of discharge, I literally didn't know that was a thing that everybody got until maybe I was like 14, 15, and my cousin was like changing at the house. And I was like, oh, wait, like you also have things in
Feeling
your
like
underwear.
the worst mom right now.
I mean, it's just like, I didn't even know it was a thing to talk about.
Well, yeah. I mean, that's the problem is that people aren't going to ask those questions or talk about it.
I mean, my education on periods was like my 4th grade teacher putting a tampon in a glass of water and being like, look how it expands. That doesn't happen in your body. So like, I don't know why that was a learning exercise. And a lot of it was like really still focused on men's health and like, this is what to do when you're with a man and not focusing on like my body.
Yeah, so I think these conversations are amazing. I love that people are using their platforms. I love that women are going to move through this phase feeling educated and empowered. Like education equals empowerment. So when we feel educated about our bodies, we can walk through that with a whole different confidence, which is amazing.
Yeah, I would say it is an interesting thing looking back when I was younger, the things that I struggled with. And then once I had, gave birth to children, then how my body changed then. And it was interesting today. I have a rotator cuff tear, and I was at my physical therapist, and I said, do you see a difference in healing? Not for this, but just in general for people that haven't given birth to children versus people that have? And she said, absolutely. She goes, your hormones, once you go through, and this was, again, she's a physical therapist, but it was really interesting to see what she has seen in her practice. And she said, when you give birth to children, like your body has gotten so beaten up, right? You have so many different hormone changes over time that it is the way your hormones are, that affects how you heal, how things happen. And it's definitely, she goes, I've seen it's definitely easier to heal if you haven't gone through all these different hormone changes versus when you have. Mm-hmm. And I was like, great. I'm going to blame my children for everything now.
Right? One symptom that we don't talk about through perimenopause, and sometimes it will happen in postmenopause, is joint pain and body aches. I'll hear from women, they're like, I just feel like I got old overnight. They're like, everything feels stiff. And it's that drop in estrogen. We actually call it musculoskeletal syndrome of menopause. And it's due to that drop in estrogen. Estrogen's very lubricating. So we say it's like lubricating to the vagina. It creates like collagen and moisture in the skin, but it can also affect like our musculoskeletal system, so our like joints and muscles, which we don't think about.
No, not at all. And I feel very validated. Now I look back and wonder like how long I was in perimenopause, because I had so many different things that, as you guys are saying, and I'm like, yeah, that was me.
I mean, you did me. Though, like,
right?
You got your whole gallbladder taken out because they couldn't figure out what was wrong, and they were like, let's just do that.
But it was bad, actually. My gallbladder was
still, but still, like, no. So many things over the years that were like, what is this? What is that? Like, what's going on? Oh, that's just, it's normal.
Yeah.
Or it's not that abnormal, like not to the point where it needs action or anything.
My knee issue, my elbow issue, like all these different things that I look back and wonder like, oh, what, were all these things related to because my hormones were struggling? And again, nobody ever talked to me about that. No doctor ever said like, "Oh, maybe we should look at this." Now they are.
Yeah.
Now they are. Now my doctor's like, and especially my husband's a physician, and he's so funny. He was like, "Okay, like I want you to stop pushing this off. You need to go see somebody." And he said, "But for me as well, because you're like angry for no reason." And so I know that you need to do it for you, but I wouldn't mind it for me as well.
Thanks, hon.
Yeah. Yeah, exactly.
Yeah, mood changes are real. Irritability, anger, new onset anxiety. When we're in perimenopause and we're still cycling, oftentimes it's easier to kind of appreciate that hormonal element to it, because it'd be like, oh yeah, I was not my best a few days before my period. So it's easy to kind of anchor to that hormonal rhythm.
Mhm.
Like, oh yes, this is like really bad PMS. I don't feel great. But when we move through perimenopause and periods become that much more erratic, or someone like you who has had an ablation or maybe we have an IUD and we're not getting a bleeding pattern, you're like, oh, is this just me? Is this stress? What's going on? So it can be trickier to appreciate if this is hormonal or is this something else that's going on.
And I want to talk about the hair loss piece for a bit, because that was something that I struggled with for a long time. And not once did anybody say, "Oh, well, maybe it's because of your hormones." It was really, "Oh, let me take a follicle to see if you have some kind of fungus, or if oh, it's just stress," but that was never part of the conversation. And I'd be curious to know more about that. But also, do you see women who went into perimenopause, didn't do anything about it for a long time, and then started on hormone replacement therapy? Do you see a change in their hair? I'm asking for a friend.
Oh, totally. I love this. Yeah. Well, I think there's a couple of things that we want to look at when it comes to hair loss. And there's sort of two nutrients that are really important for supporting hair growth. And one of them is vitamin D. And so we would want to test vitamin D to make sure we're not deficient. And if we are, we would want to supplement appropriately. And the second one, which is very relevant for perimenopause, is low iron. And so it's very common in perimenopause that women have heavy cycles. I'm assuming that may have been part of the picture with the ablation to stop the bleeding, is we have really heavy periods. And that will often lead to low iron, which does not favorably support hair growth. And so, yes, there are hormone changes that can lead to hair changes, but there's also, if we're living a decade with low iron, that's also not supporting hair growth. And when we're looking at iron levels and where we want them to be, just being adequate, like one notch into the normal reference range, is not optimal or ideal for thriving hair growth. And so our targets need to be a little bit higher. And so sometimes I'll see patients, again, everything looks good with your iron. And I'm like, yeah, but it's not really where we want it to be supporting proper hair growth, mental health. We live in Ontario, and they just changed the reference range for iron like within the last 6 months.
Oh, wow.
It used to be so low and it was so frustrating, and the data is there to support that it should be higher, and they finally updated it on labs. But there's the other elements that could be playing a role that may be impacting it. And then there's also the hormone implication. And we know that estrogen does play a favorable role. And it can be helpful for some patients. It can be helpful. It's never, there is a natural decline, thinning of hair that happens in perimenopause and early postmenopause. And sometimes it helps to mitigate some of that.
Right.
Looking at those other factors. Thyroid is another thing to consider as well. So looking at thyroid function, that can play a role. Looking at overall nutrition is another thing. Like, are we getting enough protein? I would say our hair is a protein structure. We want to make sure we are getting enough protein.
Someone else was saying something to me about protein recently, and I was just kind of curious about it. That, again, as women, as we age, as we go through menopause, that protein is something that we need more than ever in that stage of life, which I was like, okay, I guess I'll up my protein shake consumption.
Yeah, and there's a couple of reasons for that. So one of the big things that women will see through the perimenopause to postmenopause transition is weight gain. And typically women will come into my office and are like, I hate this. It's all in my belly. Like, I never used to have this. It used to be in my hips and thighs. Now I have this all going to my abdomen. Like, what is going on and why? And a lot of that has to do with the influence of estrogen. So estrogen tells our body where to put fat. So as we enter into puberty, this is why we'll see girls get hips and thighs, right? They get that estrogen influence, and that causes that shape change. As estrogen is leaving our system, we no longer have that influence. So now we're going to start to store that in our abdomen. There's a couple of reasons why women will gain weight through this transition as well. So one, women don't feel great.
Mm-hmm.
So then to show up and exercise and meal plan, and maybe I have teenagers at home and I have elderly parents and I have very little time to prioritize like my own self-care. That's certainly a reality. And then we have this natural decline in muscle mass. So we start to lose muscle as we get older. And this is why women will say, I'll come into my office, I'm doing everything I did in my 20s and 30s, and the weight is going on, and I don't know why this is happening. And it's that loss of that lean tissue, it's that loss of muscle mass that affects your calorie burn, like how many calories your body will burn. So your metabolic health changes. So there's like two things that need to be really important to support muscle health. And one of those is protein. Our muscles fuel on protein. So we need to make sure that we are getting adequate amounts. And two, we need to make sure we're strength training. We need to lift heavy.
I'm kind of failing at both right now, just so you know.
It's never too late. It's never too late. It's never too late. But like, lift heavy is key. It's key for that like body recomposition. It's also key for our bone health. It's key for longevity. I get super passionate talking about like lifting weights. I will talk to patients all the time to hype them up and get them excited about weight training. And I'm like, go hang out in a nursing home.
Yeah.
Go watch
so
those
true.
that are thriving and those that aren't, and tell me the difference between the two. I'm like, it's mobility, it's our ability to move, it's our ability to get out of a chair, and that's all muscle.
Yeah, Liv, your dad says that to me every day. Lift weights, lift weights. Now my problem is with my shoulder. I'm like, how do I do? How do I compensate for? I don't know.
Just use other parts of your body.
Then you do lower body.
Yeah.
Quads.
Easy.
Yeah.
Yeah. And then you got to fuel. You got to hit it with the protein piece. Our ability to absorb protein changes as we get older and as we move through the transition. So we need to kind of like overshoot our protein amount.
How do you think diet culture and like the toxicity around that has affected menopause and perimenopause?
It's wild. Yeah. In the sense of, I feel like there's always so much nutrition noise. People are confused. Confused. It's noisy. The women who are getting to this phase 2 were surrounded by a culture growing up of being skinny. Right? And it's like, we really need to change that to being strong. Right? If we can approach this decade, and I always say like, this is such a pivotal turning point for women, because what you do in your 40s and 50s is going to really set the trajectory for what your 70s, 80s, and 90s look like. And so I get really excited when I see women at this phase going, we can change this, but we want to shift that narrative from skinny to strong. And we want to just like break through all the nutrition noise and confusion that is out there online. And I think there are real changes happening to women's bodies. They are gaining weight. It is going to their midsection. It is distressing. It is affecting their confidence. It is real and it's a thing. And so they're grasping at any piece of information or what they had done in the past, right? They're trying things. And I think, what would be really nice if we could just dispel all of the noise and just make it really simple and easy for women. But I think, two good places to start is, focus on protein, make sure you're strength training, those are like two really great places to start.
Yeah, I think it's a really, really hard thing. Again, bringing it back to confidence is that when you were younger, you worked so hard and you did all the workouts, you did all the things. And then all of a sudden you feel like you're still doing all the things. And then all of a sudden, whoop, that's not my body, right? I look in the mirror, I don't recognize myself. I can see how it has become a real, and then women don't want to talk about it, or they stop doing whatever they're doing because they're like, well, what's the point? I'm just going to fail. I'm just a failure. And I think that what you're saying is absolutely the opposite of what needs to happen, and that we need to own it. And we just say, I'm going through menopause, right? I mean, I'm in perimenopause, I'm postmenopausal, whatever I am, but, and then taking the steps that we need to take so that we do feel good about ourselves, because it's not, and I think one of the things is that so many of the issues that we go through, especially as women, is we don't talk about these things. And again, with this, I think the more we talk about it, the more women will be like, oh, wait, I'm not alone in this.
Totally. Yep. Yeah, absolutely. That's, I say this a lot to patients. We see patients one-on-one a lot in our practice. And I'm like, when we can get women together and have these conversations, they can recognize that they aren't alone and that the struggles are very similar from, woman to woman. And so if we can, talk about that and normalize it, it can help a lot. And
so, go ahead.
Lori, I was going to say, and I try to educate with my patients and talk to women in my practice about moving away from chasing a number on the scale and celebrating their new body. And I'm like, can we make more exciting goals than this silly number on the scale? And like, let's focus on fitness. Let's focus on you being able to do like push-ups. Let's focus on you being able to do like a chin-up. Like, let's focus on things that are like, to me, way more exciting than this like silly little number on the scale that so many women can get so caught up in.
Yeah, I look back, and when I was in college, I think I weighed 125 pounds. I'm like, that wouldn't even be attainable. So it's not something I would ever strive for. And I really don't. Even when I went to the doctor yesterday, he said, what's your weight at? Like, just to record it in the book. And I was like, honestly, I don't know. We're going to have to go weigh me, because I won't weigh myself in a bit. And, I was a little shocked when I stepped on the scale, but you know what? I fit in my clothes. I feel comfortable in my skin. I'm not worried about that number, because you can drive yourself absolutely mad every day if you weigh yourself and you're up by a pound. Oh my gosh, I gained a pound. Well, again, what Liv was talking about before is that as you go through different parts of your cycle, things change, right? It's not because you ate that brownie yesterday, right? And then we start saying, oh, you can't eat this or you can't do that, because then we feel bad that every day it's something different.
I mean, I look at myself. I had a severe eating disorder in college, and I have gained 50 pounds since then. And like, hearing that number in my head is so scary. But also, like, the worst thing ever was coming home from winter break and my mom being like, we're going to have to keep you home a semester if this keeps up. And it was like a hard experience hearing everybody around you being like, you actually look gross. Like,
I didn't say gross.
Dad did.
Okay, we were just trying to
shock
it into you.
Yeah, but I mean,
it worked.
It is kind of, yes, it did. It is scary to think about, like, just hearing that number in my head, like 50 pounds, that's a lot. But also, like, I needed most of that.
Yeah, absolutely. I think it's going to be a number that becomes a bit obsolete.
Yeah.
It does not define health, right? Somebody that you can have two people that the same weight, and one could be full of muscle and lean, and one could be walking around with excess body fat all around their midsection. And so like the definition of health in that number can be very different. And so I get so frustrated that we get hung up on it, because it's really not a great definition of our health.
Yeah. And I'm curious, like, again, because I don't focus on the number on the scale, and I know a lot of women still do, but is it the same thing where they give you the whole BMI or body mass index and you say you need to be in this range? Is that still part of what happens at an office?
Sometimes, but I think it shouldn't. I think we should care a lot more about your waist measurement. I think we care a lot more about our lean muscle tissue. Are we gaining muscle? What's our body fat percentage? Those are numbers that, the number on the scale could stay the same, but those metrics could all change. And that's going to be improving your health. And I think sometimes it's also recognizing that the actions that we need to put in to see changes in those numbers, even if we don't see changes in those numbers, they're improving our health. So if we show up and we exercise and we move our body daily, that's improving your health.
Yeah, for sure. I do see a lot of people be like, okay, I went to the gym. Now I'm going to go have a donut and a milkshake. And I'm like, well,
Yeah.
I mean, I'm going to have the donut and milkshake anyways, but, I don't think you can use it as an excuse, because I think people get confused with that as well, too, that calories in, calories out. And obviously it sounds a bit more complicated than that, especially when we're talking about protein, which I think is such an important conversation, because I mean, I'm from the days where it was the whole diet culture and you focused on the low fat, right?
Oh, yeah.
The low fat, the fake sugar, all those kinds of things. And
that causes cancer.
It's so interesting how many things have changed over time. I mean, I guess we see that throughout history as we deal with health, as we deal with women, all these kinds of things, that we only know what we know, right?
Mm-hmm.
So as soon as we move forward, but it's really about exposing more women to understand, here's what you're going through and here's how we can help.
Yeah. And, I think breaking down that nutrition noise and like taking it back to some basics. I'm always like, is this a whole food? Like, if this is a whole food and this was alive somewhere in nature, this is probably a good choice for you. If this is processed, packaged, like, it's not about perfection all the time. Like, we're both advocates for very balanced living, and you can absolutely eat your cake and have your pizza and do your thing. You just can't do that every day. So we need to have this like moderation approach to it, but really focusing on whole foods that are going to nourish your body. And I was talking to a patient even just this morning saying, like, think of your food as like an act of self-love. Like, are we loving your body? Is this food loving you back? And sometimes that can be a helpful switch.
Yeah, I think that is really helpful, that your body is a temple kind of thing, right? I mean, and sometimes I'm like, how many snacks can the temple take? But yeah, I mean, I definitely think that's important to look at it as self-care, because I hadn't really thought about it directly in those terms, but I think that's a great way to think about it, because I think that will help a lot of women think, oh yeah, wait, am I really taking care of myself right now? And I think that's really crucial.
So, Mom, you're post-menopause now. What does that
Yeah.
mean for you?
Well, I mean, it means that I want to try hormone replacement therapy, because I don't have really, again, my estrogen is undetectable. So, all the things that happen where your sex drive is down, all stuff you want to hear right now, your sex drive is down. You have vaginal dryness. You struggle with sleep. I mean, there's so many. I mean, you guys can tell us more, but I mean, these are the things that I have been struggling with, still with the hair loss. And still I have mood swings, but I think that so much of it, I'm like, okay, if there's something that can make it better, obviously, and again, talking there, historically, there was, and again, just like anything in medicine, we're talking about stuff before anybody does anything different, research it. Don't just listen to what we're saying here. But there was a study that was done that showed the high correlation between breast cancer and hormone replacement therapy. Now, so what happened was there's a whole generation of women that just were never given the option of doing hormone replacement therapy, because there's a chance you could get breast cancer. Well, obviously that study wasn't well defined, right?
No.
And so a lot of people lost the opportunity to live their best lives because that wasn't even an option given to them. So now it's something that, again, my doctor is talking about it. More doctors are talking about it, because they've realized, just like many studies out there, it wasn't the right study. I mean, and sure, yes, do you have to? I mean, you don't want to take just unopposed estrogen, right? You want to be able to take, you want to take progesterone with it, but really understanding that piece, and not just saying, oh, if I'll have women say, oh, if you're on HRT, you're going to get breast cancer. What? Okay, that's not, I mean, so debunk that myth for me right there.
Yeah, so that study you're referring to is the Women's Health Initiative. It was in 2002. It was the biggest study we had done on hormone therapy. And we were doing hormones differently back then. We did an oral estrogen, and we did a synthetic progesterone and a synthetic estrogen. And what we learned in that study is that we increased the risk of clots and that we saw a small increase in breast cancer risk to the tune of 1 in 1,000 when it was used for 5 years.
Mm-hmm.
We also had women who were significantly older. We took women who were more than about 10 years post-menopause. The average age was 60. And so what we've learned since that study is that the safest way to deliver estrogen is topical, that using a progesterone, which is body identical and not a synthetic progestin, seems to reduce the risk of breast cancer. That seems to be a better option. And if we do it in the right patient, then it is a better option. So catching women early on, either in perimenopause or within 10 years of their menopause date or under the age of 60 appears to be a better option. And so this is a great conversation to have with an informed clinician to assess your own personal risk. What is your own risk factors? Is this a good option for you? And it's something that we do. I prescribe it almost daily. And it's something that I will assess with my patients every year because your risk profile may change.
Mm-hmm.
Right? So starting you tomorrow may be a great option, but 5 years from now, that may not be the best option. And how long we want to use it is also a great conversation. Do we want to use it to help mitigate just the symptoms as we're transitioning, or do we want to stay on it longer term to maybe capture some bone health benefits or some of the other benefits that may exist with us being on it a bit longer?
Yeah, I think that's really helpful because, again, I think we get so scared by things when we don't know enough about it. So it's really about doing the research, talking to your clinician, really understanding what's the right thing for you. And for me, so far, it's been the right choice. I can tell you, it's been a month and my hot flashes are gone and my night sweats are gone. And those were killing me because I would wake up and I'd be like, oh my gosh. Or even my glasses would fog up. It was like the most ridiculous. I'm sitting there and I'm like, sorry, I can't see. My glasses are fogged up. Having a hot flash. I'll be back in a minute.
Yeah.
And, so certain things like are affecting my daily life that I really wanted to deal with.
Big time. And there's always, with any medicine, there's a risk of treating, but there's also a risk of not treating. So if
Yeah.
you're not sleeping, what does that mean for you? How are you able to show up the next day? How does this impact you?
Yeah, I agree 100%. So I want to ask you about your perimenopause playbook.
Yeah.
Tell us about that.
Yeah, so this is our program, our online program, where we put together a bunch of modules to educate you and inform you and walk you through A, what's happening to your body, B, what can you do about it. So we walk through how we need to be moving, why sleep is important. We just talked about hormone replacement therapy, and we have a whole module in there about that. And nutrition, but I always say, like, hormone replacement is like a piece of menopause care.
Mm-hmm.
There's so much more to the diet, the lifestyle. We go through all of that within that program. So it's a really great place for women to get informed and get started and do what they can to support their health.
Yeah, I love that because, again, and for some women, they might not want to talk about it out loud. So the fact that they can go to an online platform and really kind of be an active seeker for education about maybe what they're struggling with, I think is really critical. Liv, it's your time.
Okay.
I say this every time. She's like, I know, Mom, I know.
What is the best piece of advice a woman in your life has ever given you?
Yeah, mine's going to echo what Nic said at the beginning, that courage breeds confidence. And I think I heard this for the first time at like a really pivotal age. And it was delivered to me by a business coach at the time. And I always thought it was the opposite. So it was such a beautiful piece for me to hold through as I was like stepping into my career. I actually had it on my mirror in my bathroom for so long. It was like my little mantra that I had up there, that courage breeds confidence. You want to hear mine? Yeah.
Yeah, absolutely.
So mine was actually from our grandmother. Our grandmother always used to say she had a son and 3 daughters. She would always say, make sure you make your own money. And for her, this wasn't about wealth, but this was about having control over her future. And so she was raised, at a time when, through the Great Depression, she went back to work in the 50s when a lot of women didn't go back to work. I remember we would drive to Montreal, she lived in Montreal, and we would go visit, and we'd have to, wait till Nanny got home from work, which was just not something that happened when you went to visit your grandmother very often at that time. And it always stuck with me. And it was, she wanted control over her life. She wanted to be able to make decisions. She wanted to,
she used to actually always say, have your own bank account.
Well, that was it. I took as money, but maybe it was bank account.
You're bank account and money, but she meant money. But she'd be like, have your own, be in control of your own financial future.
It's crazy to really look back and say that, it hasn't been honestly that long that women could get their own credit card, right? I mean, that's a crazy thing to think of that. And Liv, I look at you and you can do anything you want to do, right?
Yep.
Yeah. Well,
to an extent.
Yeah. Well, to a good extent. But yeah, I mean, my mom went to medical school in 1961. She was she was one of 5 women in her medical school class. And that was it was brutal at the time. Yeah. She actually said when she finished, it wasn't an option. If she wanted to go into private practice, nobody would have come to see her. The only reason that she could get patients to see her is because she worked for an actual hospital. And I was like, that is so depressing, right?
Yeah.
Wow.
I mean,
that's wild.
So yeah, it's wild. Liv, tell us about your calendar today.
There really is no destination. There's only exploring, exploring, and exploring.
Yeah, I think that's pretty valid for today, right? We're trying to figure out everybody's body is different. Everybody's unique. Everything you go through is different. Go.
Menopause doesn't mean the end of your life.
Totally.
Nope.
Yeah.
It's a new beginning. That's how I tell women. I'm like, let's celebrate this. You're stepping into like a new time in your life. It can be really exciting.
I wish I knew my anniversary date so I could actually celebrate it.
Yeah,
I need one more thing to celebrate. I know, right?
Let well.
Oh well. Yeah, pick a date for me.
Okay.
Pick a date
I'll
for
let
me.
you know.
So where can people find you?
Yeah.
So especially your playbook and how they can connect with you.
Yeah, so there's info on our website, which is drnicandnat.com. We're also pretty active on our Instagram at Dr. Nic and Nat is the best place to come hang out with us and come learn about the things that we do.
I love it. This was really helpful for me. I mean, I'm sure it was helpful for everybody listening, but a little selfish me today of like, oh, what else can I learn? What else can I know? So thank you so much for being here. So we always end now with a confidence tip of the day. So here's the tip of the day, or the tip of the week. Why do I keep on saying the tip of the day? We only record this once a week. Speak to yourself like you would your best friend. Replace self-criticism with encouragement. The way you talk to yourself matters. Make it kind, empowering, and true to your worth. And always remember, you are unshakable. Thanks so much for joining us today.
Bye, guys.
Thank you.
Thank you for listening to Her Unshakeable Confidence with Simone and Olivia Knego. We hope this episode has made your day just a little bit brighter and given you the inspiration you need to confidently go about your week. Always remember to be authentically you. Don't forget to like and subscribe so you never miss an episode. And feel free to connect with them on Instagram at Simone Knego and at Olivia Knego. Till next time.